There was some research back in the 1970s and 1980s where couples counselors would use psychedelics like psilocybin from magic mushrooms, or they might use MDMA, which is the active ingredient in ecstasy. MDMA isn't really a psychedelic because it acts differently on the brain, but sometimes people think of these drugs all in one group. But in either case, whether it was MDMA-enhanced couples counseling or psilocybin-enhanced couples counseling, what some people were finding in these early therapeutic sessions, and mostly this is a series of case studies. You don't have too much systematic research back in the 1980s, but therapists would report on their experiences working with clients. And what they found is that, for a lot of people, there are certain things in their relationship that they know they want to work on, but they can't bring themselves to really talk about it productively with their partner. For example, they might be stuck in a loop there where there's, the same grudges are repeated year after year, or, you're just so used to your partner acting a certain way and you respond in a certain way, and you're caught in this unproductive cycle where you can't really hear your partner with fresh ears. You're almost just drowning them out with your defense mechanisms or whatever it might be. And if you're in this kind of situation, but you really, both of you feel that there's something in the relationship worth preserving, and you want to try to improve your connection, and you've tried talk therapy and it hasn't seemed to work for you, one possibility is that under the influence of these drugs in a therapeutic setting, first of all, some of those defense mechanisms might be temporarily disarmed, so that you find yourself responding in a more reflective way, where it's not so automatic stimulus response. You may be able to hear your partner in a new way and look at them with fresh eyes, and maybe remember how you felt when you first met them. So some people reported that they felt after these therapeutic sessions with MDMA that they felt like they were 16 again and just falling in love with their partner, partly because what some of these drugs can do, at least what the current theories are suggesting, is that they sort of wash out old habits and patterns that have become ossified in your mind. So they sort of depress some of your prior beliefs and concepts and allow you to take in information and categorize it less rigidly. And you can look at it from a new perspective and sort of decide now whether you want to create some new categories in your mind for how you think about your partner or think about the dynamics between you. In the case of MDMA, partly what it does also is it temporarily suppresses a hair trigger fear response, which can come up in the case of trauma. So right now they're doing these trials looking at MDMA-enhanced psychotherapy for people with post-traumatic stress disorder that haven't been able to treat their symptoms with other methods, although they've tried them and they haven't succeeded. And for people with treatment-resistant post-traumatic stress disorder, what they're finding so far is pretty promising results, where instead of shutting down when they're asked to talk about the trauma that they've been suppressing, they don't have that immediate fear response under the influence of this drug, and so they're able to kind of approach the trauma and work on it with a therapist, and that alone can have very positive effects for relationships in the sense that PTSD can be very damaging to relationships. And so if you find a successful treatment for it, then it's not going to be good just for you, but it might be good for your relationships as well. And very recently now they've done some preliminary trials with couples that are more rigorous than what was done in the 1980s, now that there's this sort of renaissance of looking at psychedelic medicine, where one of the partners has PTSD, but the other may not, and then both of them will undergo drug-assisted psychotherapy and work on various things in the relationship, including the PTSD. But a point that we raise in the book is that trauma falls on a spectrum. Not everybody meets all the clinical criteria for getting an official diagnosis, but sometimes relationships themselves can have aspects of trauma that have come up over the years. And so there's some reason to think that people with subclinical difficulties in their lives and relationships might also benefit from these kinds of drug-assisted psychotherapies. And so we propose that more systematic research go into that question.